let's hit it.
And welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
Well, hello and welcome back to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and once again, I am thrilled that you are with us. We're going to have a really interesting conversation. I love talking to youth and young adults, and they are leading the way to change and giving us so much hope for the future. But before I introduce our guest, I always like to talk to people and just welcome them to our show. For those of you that are new, Alzheimer Speaks is really about being inclusive. We like to hear from everybody at all ages and stages around the world. So maybe, just maybe, you will be our next guest. Please feel free to reach out to me at radio@alzheimerspeaks.com. My own personal experience is my mom lived with dementia for 30 years, and I know we are better together. There's no ifs, ands, or buts about that one. So we are going to, like I said, have a great conversation, but I want to give a couple of shout-outs. One is to volunteering for seniors. On November 11th, and you're all welcome to attend this, I'll be doing a webinar with them about living with dementia, and we're open to taking your questions. And then on December 8th, I have another public event coming up that is sponsored by Artist Senior Living of Woodbury, and that one actually is going to be in person, and we're going to be talking about family gatherings, events, and travel, and how do you make these special times not so difficult? How do you get back to the joy where everyone can find peace and happiness and build memories? So you can check out all of our free resources on alzheimerspeaks.com, and then just go to our free educational resource center, and there you'll see a bunch of icons. You can just click on any of them. One of them is Dementia Map. And if you haven't checked that out, please do so. We have 150 categories that people can search. There's also a calendar of events. There's a glossary of terms, some wonderful articles in the blog, just so much there. So, you can either access that through alzheimerspeaks.com or go directly to dementiamap.com. We are going to hear from the Adaptive Equipment and Caregiving Corner, and then we're going to be right back with our guest to talk about the youth movement against Alzheimer's.
I love the footbar walker, and let me tell you why. It is the option for my toolbox that I've been waiting for. Let's be honest, there are some clients who, despite our best rehab efforts, just aren't able to return to performing a sit-to-stand transfer on their own. Now I can offer my caregivers an easier, safer option that doesn't involve hoisting their loved one up from a sitting position. I don't recommend this walker for all of my clients, but I do recommend this walker for those caregivers looking for an easier, safer option with transfers. I would also encourage other therapists to add this walker to their toolbox. It's kind of like having my own mobile parallel bars for the client to pull up on. Whether it's a family caregiver at home helping a loved one with Parkinson's or dementia, CNAs in a long-term care facility assisting their patients, or therapists adapting to client and caregiver-specific needs, we now have a very safe and effective option to offer in the footbar walker. Check this product out at thefootbarwalker.com. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.
And if you haven't gone to their site, please do so. They are a wonderful resource. I don't care if you are having a knee or a hip replacement, or if you are going through transition and need help with toileting or eating. They review so many different types of gadgets. You will be amazed at what out there is, or what is available out there to help you. So again, today I'm finally going to introduce you to our guest. We are going to be talking about the youth movement against Alzheimer's, empowering generations for change. And I am so thrilled to have with us the chairman and founder of the youth movement against Alzheimer's, known as YMAA. And Nihal is, I'm sorry, I'm gonna screw up his name, and I promised him I wasn't going to, and here I go. Nihal Satyadev is with us, and he is just an absolutely exceptional leader. Their group really puts forth college and high school students as advocates, as researchers, and they help provide care for those battling dementia. He is also a published researcher, and his primary interest is dementia and machine learning. Nihal is currently at the University of Medicine and Health Science, and he is a member of the Duke Global Neurosurgery and Neurology team there, and he holds his master's in public health from George Washington University, and he also has a BA in computer science. So I looked over his resume, and it is pages long what he has accomplished. So I can't even begin to tell you the difference this man is making already, and I'm really excited to see what he does in the future and watching his career. So welcome, Nihal. How are you doing today?
I'm doing great. Thank you so much for having me. Excited to chat.
And please say your last name correctly, because I totally crucified it, and that was my fault. I'll be honest, I got a kind of an alarming kind of urgent text all of a sudden, and it threw me for a loop, and I shouldn't have let it. But go ahead and pronounce your name correctly.
Absolutely, no worries at all. It's a challenging one. It's Satyadev.
Okay, wonderful. And I think it's actually easier to pronounce than what it looks, and that was one of the excuses that I will go by there. So again, thanks for coming today. I always like to ask my guests if they've been personally touched by dementia in their own family or circle of friends. So do you mind sharing that with us?
Yeah, absolutely. So both my grandmothers had dementia. One of them was actually diagnosed with Alzheimer's disease. The other one never got a true diagnosis of the cause of the dementia. But the one that did have Alzheimer's disease did progress for about 15 years after the diagnosis. So she had a bit of a longer journey with it. So yeah, it's on both sides of my family.
Okay. I know with my family, I'm 63, so I know my mom had it for sure. My mom always mentioned that my grandma had it, but the rest of us all thought it was, the morphine from the cancer, where she was having difficulty because there was, no one really talked about it back then. So on my side, we really don't know. But I am amazed at the family history when I go out speaking that, people will talk about. So it is just something that hits so many of us, and it's an important conversation that we bring to the forefront and be able to do that in a comfortable fashion so people feel okay entering the conversation. Why don't we talk about the youth movement against Alzheimer's? How the heck did it get started? I always find these as such fascinating stories.
Yeah, absolutely. So with my interest already being in dementia, having it been in my family, I'd already been doing some research during my undergraduate years on neurodegeneration. One of the things that I did to sort of complement that was volunteer locally to create a congressional district maps on the prevalence of Alzheimer's and to help create public policy maps. And so during one of the national conferences that I attended, this was at the time for the Alzheimer's Association, I noticed that they had like a younger, like under 40 section. So first of all, in my mind as a 20-year-old, I was like, that is not what I expected for the younger people section.
That's not young, yeah. Yeah, I can appreciate that very much, yeah.
And even in that section, in the conference, there was like 1,100 people, and only about 40 of them were at the session. And so I was shocked at the sort of demographic that was there, and especially having worked on some of these public policy efforts, I understood how challenging this is, not just for older adults who are personally affected by it, but also because of the economic bear down that it has on entireties of individual families, but also on the overall cost of our healthcare system. So I went back after that conference. I was like, oh, there's probably already, an organization sort of like the Colleges Against Cancer for this disease. And when I looked at the top ranking 150 colleges, 4 of them had an active organization around dementia. And so at the time, that was very shocking to me. And so I gathered up a few of my friends who I knew were very passionate about healthcare reform and addressing challenging healthcare topics. And we started a group. And at the same time, we essentially met peers of peers who would be interested in starting chapters elsewhere. And it really began as a grassroots movement to get college and high school students to start advocating for this disease and start looking at it not just as a disease that affects older adults, but also as the greatest public health crisis of the upcoming several decades.
Wow, I'm still giggling at that when you talked about the over 40 or under 40 group, and appreciate so much that as a 20-year-old, 40's old, and again, when I think about the need for us to be more inclusive, I mean, even looking at, under 40, I mean, that was a huge step right there, in terms of pulling in the loop, but we have such a wide net. There's no reason every person at every age can't be involved. I mean, there are things to contribute at all ages. I see intergenerational interaction with, kindergartners or preschoolers, with our elders. And, there's so much compassion and fun that can be had and learned during this process. So kudos for you for moving that needle, further on down and including more younger people, because, every generation, and I don't know if you believe this, but I've seen this, and granted there's some overlap, but every generation approaches problem solving a little bit different. And I think that's a good thing. What are your thoughts on that?
I think it is definitely a huge area where we are sort of undertaking advantage of the sort of natural course of intergenerational relationships. I think you're absolutely right. In several other cultures, there is sort of like a structural connection between grandparents and grandkids. Older adults, retirees do have a natural role to play in sort of building up the next generation, which I don't think is as integrated in our culture. But I also think that we are underplaying the role that younger individuals have already in dementia. And what I mean by that is a large percentage of them are currently family caregivers. There was a beautiful study that was done by University of Southern California in partnership with Us Against Alzheimer's. And this was published, I want to say, about 3 years ago, and they found that 25% of family caregivers were between the ages of 18 and 34. millennials were defined by that age group at that time, which essentially means we're missing large swaths of people who are even under 18 that are providing care. And so this is really not at all a disease of older adults as of 2022. It's a multi-generational disease in terms of who it directly impacts.
Oh, I so agree with you. I used to go into the high schools and speak. And when I would talk, I would ask, how many of you are caring for a loved one? And it was shocking because it was something no one really talked about. But I would say a third of the class, typically of every class that I went in and talked to, had somebody in their family that they were caring for. But what was really interesting, and I'd love your opinion on this, was they were excluded on what was really going on. And so they had to kind of guess why the family dynamics changed and how they could really help. They were just kind of out of the loop because it was like parents didn't want to burden them. But by not talking about it, in a lot of ways, they said it made it worse for them because they didn't feel part of the team, and they wanted to be part of the team in a bigger fashion.
Yeah, I'm not surprised by the number of people that raised their hands. I think that also does speak to, I'm sure, the sort of openness culture that you created during your visits there. But you're right, it absolutely is sort of a shadow underneath our society that so many people are providing this care. And I think the challenging thing with young people specifically, and in this context, I'm specifically talking about teens and individuals in their early 20s who are providing care and who often at times are primary caregivers, is that they do have to set aside their career trajectory, or they have to, take extra absence from school. And there aren't necessarily set up structures to account for this, especially in the job market. One of the biggest traditional red flags is, oh, you haven't been employed for the last 3 years. Like, tell me about that. But that is if you get to that question even, and you're not already pre-screened where your resume is thrown out because of a gap in years. So I do think it's something that we do need to speak about more openly in terms of the reality that people are going through. And I think the challenging thing about discussing caregiving around dementia or any other chronic condition is the people who are providing the care and who are doing this challenging task really don't always have time to, and rightfully so, have time to both be doing that challenging task and be advocating for it as well. And so it's really the responsibility of those of us who, like yourself, who've been through this and are taking on a larger role in speaking out loudly for this, and those of us who understand what challenge this is and may not even be personally affected, but understand the ramifications of this societal underpinning.
Yeah, the other thing that was really interesting, too, in the schools was, and this would come up in our conversation, was there's no support for us. And they're like, we have groups for this, and we have groups for that, and we have groups for this, but there's not a group for us where we can get support. But then some of them spoke up and said, but we can't really stay for a group either. We have to get home, to take care of whoever. And so it was really eye-opening, and it was really sad at the same time. And yet their insights were so powerful in terms of family dynamics and, how this disease is even hidden from family members, in terms of total truth and honesty, in terms of trying to protect somebody from maybe what they foresee as the burden of the disease, but not looking at some of the positive benefits of helping somebody out as well. And, that compassion and that empathy, those are huge life lessons to be learned that will stay with you forever as well. So, the dynamics of this disease, I think, are just really unfolding. And the more we have the conversation, the more stuff, we will learn about as we go through this. How do you, pull youth in? How do you get them excited about stepping into this space?
Yeah, I think you bring up several good points there. I think the key thing to understand is, like you said, there are already so many youth who are experiencing this in terms of their care role, or in terms of having a family member that is affected, but there isn't really a channel for them to make a difference without having to go out of the way and create an amazing radio talk show, for example, but have a more low effort way of making a difference. And so that's really the space that we're trying to create. The way we try to get youth excited is we really just share with them the reality of what this disease presents from a public health perspective. I think the people that are primarily affected in their families already have a really good understanding of the emotional toll and the financial toll that this has. But when you explain to people, this is the most expensive disease in our country, and the number of people who are going to have this disease is going to double in the next 10 to 15 years. And we don't have a good public health plan for what we're going to do when those costs reach those levels. That is quite scary. You cannot vaccinate yourself out of dementia. And so it does take a strategic planning at the national level. And a big part of that is addressing the workforce needs of older adults. And that's really what our logo is, which is it's a population graph. And so it is a Y with the population graph, which is what America's population graph is headed towards. And we've highlighted this sort of small section around youth. And the reality is there's less and less kids being born. There's less and less individuals who would have in previous generations been taking the economic role or the caregiving role or whatever it may be. And there's more and more people who are going to be needing caregiving as a secondary to them reaching this geriatric population. So I think once you pose the fact that this is a huge public health challenge and you express the fact that this is an issue at that level, students want to be challenging big issues, and I think that's the beauty of our generation, and realizing we do have a lot of issues to solve, and this is no less than any of the other ones.
Yeah, and like you said, there's so many different things coming into play, in terms of just families as a whole, where they live are more spread out than what they were back in the day, so people could gather around, and families are more splintered too. They don't function as a team as much as they used to back in the day. It is really quite amazing. And then just changing the face of who can get this disease. I mean, those numbers are dropping in terms of, this isn't just an old person at the end of their life disease anymore. And I think that has had a huge impact on people too. I've interviewed many people in their 50s, 40s, and even 30s, that have been diagnosed, and a couple of parents with children. So there's so much to learn from a research standpoint on what even causes, the different types of dementias, and then, being able to support that as a community, kind of like we have with cancer and heart disease and all those other things, that we're not getting the funding, and we're not getting. We're still, I think, grappling at being inclusive from different cultures to different ages altogether. So, kudos, for you and your group for what you're doing. Let's talk a little bit about the importance of respite care. What kind of feedback are you getting, from your members in terms of what is needed for themselves and for their families?
Yeah, that's a really important topic, especially I think for caregivers who currently might be listening. So we know the numbers around caregiving as of today are quite broad. I mean, for the approximately people who have dementia, there's somewhere around 16 to 18 million family caregivers, and 40% of them have been diagnosed with depression, because caregiving is not an easy task. And so we're essentially having more people who are suffering from depression because they're taking care of someone with dementia than people with dementia. And a big part of us addressing that is through opportunities to alleviate the burden of caregiving. And so I think one important area around that is respite care, or otherwise known as simply taking a break, but that can have quite profound implications for someone providing care 24/7 around the clock to simply have a breather. And so I think the challenge we have in implementing broader scale respite care is a couple-fold. One is that a lot of caregivers don't identify as caregivers. I think they this is just like the role that, culturally or in their family they're expected to play when someone is ill, and fair, that's fair enough. But I think they still, are providing that care, and they still do deserve a break, and they should recognize themselves as, caregivers. And then the second part of it is that oftentimes accessing respite care is not very straightforward, and it can be very expensive. And so this is where I think you have a big opportunity to play a role, is by providing that respite care in a volunteer fashion. And so I do think as we are able to better educate caregivers on the importance of taking a break, not feeling guilty for having to take a break because there are limitations to the human capacity, and if they're not taking care of themselves, they can't take care of their loved one. And as we get more young people to understand the implications of respite care, I think this is a big opportunity for us to address this from a public health perspective as we await cures and therapeutics down the pipeline.
Oh, I so agree. And, that message is still, in my opinion, under-delivered, that we have to take care of the caregivers and the care partners, the care companions out there. We need those people healthy to support their loved ones. And, the way things are going, especially since COVID, we're seeing a lot of communities close down. I mean, I know here in Minnesota, we have very, very few adult days that are even open anymore. They haven't come back. And, we're hearing – oh, go ahead.
I mean, sorry, no, I was just going to say that's in cities across the country. I've heard that in San Francisco, LA, in Boston. So I've heard, I think that's a trend we're seeing across the country.
Yeah, and then we're also seeing, communities close, from nursing homes to assisted livings to memory care, that can't staff, and it's just too difficult. So we've got to do something better, and we've got to be able to train not only our families, but we have to be able to support them in different fashions as well, and it's just absolutely critical. Can you tell us, what is your vision for youth care? What does that look like?
Yeah, absolutely. So what we did to partner students with this opportunity to provide respite is when we first started our organization at UCLA, we partnered with a physician, Dr. Zaldi Pan, whose brainchild was this program called Time Out at UCLA. And it's absolutely brilliant model. Essentially, we train students to work with early to mid-stage individuals who have dementia. We give them the tools to communicate with them appropriately, and then we partner them based on similar career interests and hobbies. And so for 3 hours twice a week, they would meet in this community setting, and that would allow the family caregivers that time off. And what we found is in our first quarter of implementing this, we partnered about 20 students with 20 older adults, and we found that the family caregivers felt that 6 hours a week, 75% of them said that was a 4 out of 5 or a 5 out of 5 reduction in their weekly stress levels.
Wow.
So I think there is a huge opportunity for this sort of short-term respite care market, so to speak. But the opportunity, in my opinion, largely lies within swaths of volunteerism. because the students who we partnered with, we tried to, like I mentioned, partner on similar interests and hobbies. And so oftentimes this was like a mentor-mentee pairing. We had one student, I remember, who was interested. He was pre-med at that time, and he was interested in research, and he was partnered with one of the one of the discoverers on the research team for some of the implications of estrogen. And so they're just chatting about science, for 6 hours a week. I was when I did the program myself, I was partnered with a Navy veteran, and we both loved the Beatles, and so we would spend time listening to the Beatles and talking about his Navy stories. And so I think when the beauty of working with the older adult population as a student is that it gives you tremendous life perspective very quickly. I think when you are able to reshape the timeline of your life into looking more at lifespan rather than, oh, what's my next job opportunity? What's my next career thing? What am I doing this year? And recognizing that we have an entire lifetime to be working on the things we find meaningful, I think it allows us to slow down and make space for efforts that support our community. So I think the vision around youth care would ultimately be to have several universities around the country be training these students on how to work with older adults who have dementia, and creating a large volunteer pool that would be able to provide this respite care. Now, the last aspect around this is that it not only reduces stress levels for caregivers, social isolation rates for older adults with dementia, and it also increases interest in areas of aging. So we also reported that in our research, that students who underwent this were better able to visualize themselves in pursuing careers in aging. And I will say the thing that I find from this as someone who's interested in public health is I think there is more research needed behind this, but I would love to see how we can continue to implement better care earlier in the stages of the disease, and essentially offset the time of people needing to enter assisted living facilities and especially nursing homes. That is the brunt of the cost of this disease in terms of its effect on our healthcare system. And so if we can, scale this sort of model of volunteer respite care to 1% of the people who have dementia today, and offset that entry into assisted living facilities or nursing homes by 2 months, that saves the healthcare system $1 billion. And so I think there is huge potential to address the high levels of cost around this disease while we are awaiting these therapeutics simply through large levels of volunteer respite care.
Well, I agree. I agree with you 100%. I think in order to do that, my perspective is again, we have to really focus on decreasing the stigma, the stress, and the fear wrapped in this disease, because people aren't talking about it. They're not coming forward to get help. And many of them don't think the help is out there. And I think part of the reason is help isn't easy to find. And, for most people, they go to the doctor and they're not given resources. They're lucky if they get the Alzheimer's Association, and that's about it. Other than a few, and I would really say a handful of clinics around our country. But this is a common problem all around the world. And until we're able to connect people to, peers and resources and start approaching this disease with hope instead of fear, I think we're going to have a really difficult time moving the needle. And I don't know if you agree with my assessment on that or not, so feel free to chime in there.
I absolutely agree with your assessment there. I think we are still at a very early stage of bringing this disease out from behind the curtain, I think it as compared to some of its counterpart diseases in terms of prevalence, it is very much in the shadows. It's very much tucked away behind facilities that segment older adults from the rest of the community. It's very much a hush-hush topic still in several cultures. And I don't think we get to some of these large-scale health changes until we address and educate people about the disease itself. So you're absolutely right.
Yeah, and I think when it comes to education, and I would love your perception on this, I'm kind of a grassroots baby. That's kind of my motive. I just get in there and talk with people and ask what they need and try to provide that. But I know when I stepped into this role, I had no desire to be here at all. But I was told by others, you have to, because you have hope and you're coming at this from a different angle. And so I listened to that and decided to switch careers. But what I really try to do, and I think that we've improved on this, but I still think we have a long ways to go. And I call it emotional-based training. We can give people all the statistics in the world, which is typically just going to scare them that the boogeyman's coming to get them or somebody in their family. But it doesn't really say what's out there to support them. It doesn't really tell them how they can still live well with this disease. It doesn't always humanize. So I think sometimes when we're educating, and I've probably flipped the needle the whole other way, I rarely even throw out a statistic because I think storytelling is so powerful. I think hearing about people's real lives and how are they adapting, because what we do all of our life is adapting. And when disease hits, you're still adapting, but yet we've shut down and we're not sharing how we're doing that. And that's, to me, that's the gut of survival, is adapting. And that's the critical mass, to get people in that comfort zone to say, I tried this, and even if it didn't work, still share it. Because that's how we learn. It's not about failure. It's about trying. I mean, we should be embarrassed that we're not trying harder, that we're not doing more, and get rid of that word failure, because I think we have built society in this era of perfection, and you can't launch anything until it's perfect. Well, my belief is, and again, I'd love to hear your ideas on this, I don't think we're serving if we're not fluid. I don't think we're serving if we're rigid and saying my way is the right way, my way, is the only way. We need to be listening to people, and we need to be adapting our programs, because the group of people that we're serving changes, and they may not have the same needs as who we were. And I think that that's one of those big cracks in the sidewalk that we're falling through on. What are your thoughts?
Yeah, I agree. I think the power of storytelling definitely far surpasses, I think, the statistics, and I think it does speak. I think it does explain also one of the reasons why your show is so powerful in terms of you actually talking directly to people who are experiencing this and elevating their stories. When we have student retreats. We've tried to bring, caregivers to share their story. We try to watch really empowering films like Alive Inside or Still Alice. And I think, having these narratives around the opportunities that still exist even once you're diagnosed or your family member is diagnosed is absolutely critical. And to your point of needing to rethink our on quote unquote failure, I agree. I think we're never, anytime with something that is as much of a societal challenge as this disease presents, if at any point we feel like we've reached the final product, we were probably wrong, and we do need to continue to keep an open mind. And I think that applies as much on the caregiving side of this disease as it applies in the science of this disease. So still a lot to learn and a lot to adapt towards.
Yeah, and there's always twists and turns. And, there's that saying, when you've met one person with dementia, you've met one. But that applies to care partners. That applies to environment. And just because it doesn't work today doesn't mean it's not going to work tomorrow. We have to give more than one crack at a thing, too. And to me, it's really about helping people build a toolkit because, and again, this is my opinion, but that there's not one voice out there that has all the answers, nor should there be. It's about coming together and sharing stories and inspiring one another on what is possible. And I hear so many people say, well, I'm not a nurse, or I'm not a doctor, or I'm not a social worker, so I really can't do that. And I'm like, but you're a human being that cares and has compassion. There's a lot you can do. More people would rather have a friend at their side than a doctor or social worker, that's, focusing on a disease. They want to be recognized as a human. And that doesn't change if you have an illness, or if you're caring for a loved one, or if that's your business of caring. That human connection, I think, draws people into making a difference in the work that they choose. And in healthcare, I think that's a big, big thing that in a lot of ways has gotten lost because there's been a couple of creepoids that say, that have crossed the line, and you can't give a hug now because of that, or you can't take a picture because of that. And we've lost some of the great goodness in the process, sometimes I think of overprotecting as well. And then people shut down that creative bubble. And it's the creative bubble that's gotten us to the moon and that's cured diseases. And we don't have the luxury of popping that bubble. We gotta keep going and expand and pull more people into the loop with their creative ideas and support them. To check it out. I just think that that's so critical. What are some of your biggest takeaways and lessons learned since you've launched the movement?
I think one of the things to kind of speak to what you were just talking about there is how many people and how many students are interested in this who, A, don't have a personal connection to the disease, and two, don't have a traditionally health-oriented career efforts or career interests. So in terms of at least our first couple of years, we kept tabs on some of these numbers. We found that about 50% of students that were joining the movement had no personal connection to the disease. And we also saw that about 30% of students had no interest in any health-related field, whether that be nursing, medicine, et cetera. And this was a really exciting finding for me because it meant that we are not necessarily changing people's minds about their careers, but if you want to go into law, maybe you're now thinking about elder law and affecting and protecting individuals from elder abuse. If you're going into the tech space, maybe you're thinking about gerotechnology and how to make traditional technology age-friendly. And so I think absolutely we need more creative ideas in this space, and the most creative ideas are not necessarily limited to the individuals who we traditionally think of as being a part of the efforts to address the cure and the care.
I love those statistics. I think that is fascinating. And I think it's wonderful because, sometimes when we, and I'll take myself, for example, you're all in and all you can see is your world and what's going on. And we need those outside eyes that can maybe look bigger and larger and clearer and, help expand what is possible. Because I think sometimes when we're in the thick of things, we just get our mindset of right or wrong, and this is what has to happen. And when you're so exhausted too, creativity goes down, and sometimes I think our ability to follow up as thoroughly as we'd like. So I think it's wonderful, and to me it shows the compassion and really mission-driven mission-driven generation to really make a difference. And I think it's just fabulous. So thank you for sharing those stats. That's really, 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 really cool. What's next for your organization? You have any big plans on the chart here?
So our goal right now since COVID, it's been challenging for us to really implement some of our caregiving efforts. So we've made a few efforts to pivot our caregiving model. We'd initially tried it in person. We finally got the appropriate liability coverage to send people directly into individuals' homes, which is where I think most of the care that is provided is done. And so after we trained our first cohort of individuals to provide this sort of in-home respite care, that's when we started having lockdowns for COVID. And so we really had to completely shift our focus into more so the advocacy side and really focusing on getting students to be aware of this disease and to essentially raise awareness within their local communities and provide education. But I think down the road, we do have more of an interest in addressing brain health. I think that's something that we be addressing from at any age, and really thinking about how do we reduce our risk for dementia. And I think there are some very simple things that everyone can be implementing in their day-to-day lives to reduce their personal risk of dementia. A couple things which we know for sure have the highest impact in the prevention space is number one is exercising regularly. About 150 minutes per week of moderate intensity exercise significantly reduces your risk of dementia. Addressing any vascular risk factors that you have. So let's say you have hypertension or high cholesterol or high triglycerides, making sure you're getting that checked regularly with your primary care physician and keeping those in control. Having a Mediterranean diet, which has been shown to be important in terms of being neuroprotective and improving cognition. And finally, the last one of these, I think, big four is getting better sleep. And I think sleep quality and sleep time on a regular basis is a critical factor to reducing your risk of dementia. And so I think that those are things that everyone can be doing. There's very powerful research to back these four. And there's several other factors also which can be done to reduce risk. But I think especially these four are something that people at all age groups can be doing to address that. So I think the earlier that we start thinking about what's good for our brain and looking at this from a preventative angle, and like you said, education, so educating even youth on what they can do, I think is critical to us addressing this as a society.
Oh, I totally agree. And I loved when you talked about sleep. Not only is it's time, but it's the quality of sleep too. And I think sometimes people go, well, I was in bed. Well, that doesn't mean you were sleeping, or how many times did you wake up, during that time. Makes a big difference in the nutrition and the exercise, and I think keeping socially active, I think, is so important. I still think that's the number one factor that kept my mom going for 30 years with this disease, was she still felt connected and purposeful. And her last 3 years, not so much, but the disease had progressed more, needless to say, by then. But I that's when I really saw the difference take hold in her, when she couldn't communicate as much with people and so forth. Now let's talk about the youth movement against Alzheimer's. Is this one organization? Do you have chapters? Is it just in the U.S.? Is it global? Why don't you give us a little more background on that and how people can reach out to you?
Yeah, absolutely. So we are a 501c3 in that regard, we're one entity, but we have 29 high school and college campus chapters. And so if you know a student, or if you're a student who's listening, simply is going to youthmovement.org to go ahead and get a chapter started. And then in terms of if you have further interest in getting involved in what we're doing, getting youth involved in your community, you can absolutely reach out to me at my email, which is just my first name, Nihal, Nihal, at theyouthmovement.org. And I think we do have a long way to go in terms of getting more youth involved, and we need as much help as we can get.
And people can donate from your page there too if they go to your website. Is that correct?
Absolutely, and we will essentially use all of those funds towards supporting increased advocacy efforts, so towards getting more students involved, towards creating better avenues for brain health education. Those would be the primary areas in which the funds would be used. Okay. And then as far as, somebody wanting to start a chapter, is there a cost in doing that or not? So there is a process to start a chapter, but in terms of the actual chapter startup costs, it's free. Okay, wonderful. Well, anything that we haven't covered, I just love what you guys are doing, and, kudos to all of you. You're really making a big difference today, but I can't even wait to see what happens from this movement 10 and 20 years down the road in terms of, making those respite connections and changing people's thinking about what does care look like and how does that affect whatever business they're in and how to deliver services. I think that is going to be just a magnificent benefit that, like you said, probably isn't looked at the forefront, but I think really needs to be. I just think that is so important for our service providers to have a little better understanding of in the trenches, everyday living with this disease, and I think you're building that out really nicely in that fashion. But anything that we haven't covered? Yeah, thank you for those kind words. And we are absolutely, just getting started in terms of some of our aspirations of addressing this disease at a larger scale. I will say to any of the caregivers that might be listening in, you all are absolutely our primary motivation around this movement, and we do want to make sure you are seen for the challenging and oftentimes unseen work that you are doing. And I appreciate you having me on here, Lori. Well, like I said, I thank you so much for what you've started and continue to work forward with. I think this is just absolutely amazing, and I would love to see more schools step in and step up and get involved in this. I just think it is so gravely needed. And I think you will get so much out by participating in this too. They always say you get more than you give, but you gotta give it first. and I just think there's so many gifts wrapped in being an advocate or an activist in terms of really changing things for the next generation. Making things more comfortable and then increasing everybody's knowledge just brings us together is my true thought on that. So again, people can go to your website, theyouthmovement.org. You can again email at info@theyouthmovement.org, or you can go right to Nihal and again, it's just Nihal, theyouthmovement.org, and then they are on Facebook as the Youth Movement Against Alzheimer's, and on Instagram they are the Youth, and then movement is abbreviated MVMT. Same on Twitter. So lots of different ways to be able to reach out and connect. Again, listeners, don't keep the details of this show to yourself. Spread the word. Somebody out here that needs this information, and it might be a youth, maybe it's a teacher or principal.
or a dean of a college, let them know this exists. This can answer and really work well, threading together collaborations that are so badly needed and being able to raise voices and, again, change our future for the better. So thank you, everyone. And again, Nihal, thank you so much for your time and energy, and everybody within your organization. You're doing amazing work, and don't for a second ever forget that. We appreciate all you're doing.
Thank you, Lori. The respect is very much mutual, and appreciate what you're doing as well. So very, very glad to be on here.
Great. Well, take care, everybody. We will talk soon. Bye now.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sebesta here, host of Retire Repurposed. Now, this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.